are you doing today?
I'm doing well, thank you.
You are now on day 3 post C-section. Congratulations. Do you feel ready to go over discharge teaching?
Yes.
Okay. So diet-wise, adequate nutrition is good for your body to heal. You should eat foods high in fiber, which include bran, broccoli, cauliflower, and fruits to help your bowel movements become regular. Eat foods rich in calcium, which include dark green leafy vegetables, milk, and yogurt. Drink plenty of water and non-sugared supplemented juices each day to satisfy your thirst and maintain hydration. Avoid soft drinks, coffee, tea, and alcoholic beverages. Activity-wise, I know you don't want to think about activity right this second, but it is important to get back into it. Gradually increase your daily activities until you are back to normal, your daily normal routine. Rest frequently, no lifting anything super heavy, pushing or pulling for the first 2 to 6 weeks or as instructed by your primary health care provider. Do not drive until you are released by your physician. So you get to be chauffeured around for a while.
Am I allowed to pick up my baby?
Yes, you're allowed to pick up your baby, but if you're having pain with picking them up, have someone assist you in picking them up from the crib or the bassinet, etc. And then, are you breast or bottle feeding?
Breastfeeding.
Okay, awesome. So some breast care. Your breasts and nipples may have changed and or grown in size during your pregnancy. Wearing a well-fitted supportive bra day and night may be more comfortable as your body adjusts to these changes. Wear breast pads until your breasts stop leaking. This will save some of your shirts. Leaking may occur for several weeks to months. You may apply ice packs between feedings to ease your discomfort. And then some helpful breastfeeding tips. Your baby's mouth should form a tight seal. The lip should be against the areola, not the nipple. If the baby is suckling incorrectly, slide a finger between your baby's lip and your breast to break the suction gently. Reposition and try again. How long should you nurse? Well, as long as your baby wants, which is usually about 10 to 30 minutes. At first, your newborn will probably want to nurse many times in a 24-hour period. We call this cluster feeding, though not for very long. It is important for the health of your breast to have your infant feed from both breasts every feeding. Good signs of nursing include hearing your baby swallow without a clicking sound, seeing movement above the baby's ears, their ears might even wiggle, and not seeing dimples in your baby's cheek. You and the baby should appear calm and relaxed during the feeding, so being in a quiet room, no crazy music or outrageous stimuli. You should feel gentle tugging at the nipple, but no pain after the first few minutes. If you do feel pain, it may mean the baby is not positioned properly or that the tongue does not extend past the lower jaw. Remove the baby and try again. And don't feel bad if you have to remove and try again. It's all part of the learning process. And then some helpful hygiene tips. Wash your hands frequently as you are caring for yourself to prevent infection. Always wipe front to back after going to the toilet and clean your bottoms with warm tap water using the Perry bottle. After you urinate or have a bowel movement, it is important you change your pad frequently, as you normally would. Bleeding-wise, vaginal flow will decrease in amount from bright red to pinkish to brown to yellow or cream color. Your menstrual period may occur as early as 6 weeks to 2 months after the birth of your baby. Bowel movements, we really want you to try and avoid constipation. You may take a mild laxative or stool softener until bowel movements have returned to your normal pattern. Increase fluid and fiber in your diet to help with this as well. Birth control-wise, discuss birth control options with your healthcare provider. Since you are breastfeeding, we will want you to take a progesterone-only birth control so that it doesn't cause your milk to dry up, because we want your baby to have all the breast milk possible. You may choose to obtain a method of birth control before resuming sexual intercourse, which we'll talk about next. Regarding sexual activity, nothing should go into the vagina for the first 6 weeks after discharge. Sexual intercourse should be avoided until bleeding has stopped and you feel physically and emotionally ready, which is super important. I just want to go over some warning signs to report to your healthcare provider immediately. If you have any of these, just give your doctor a shout. Pain, redness, warmth, swelling, drainage, or foul-smelling discharge from the incision, or the incision begins to open. This can be a perineal laceration or C-section incision, which would be your C-section scar. Discharge from the vagina that has a bad odor, severe headache or blurred vision or visual changes, temperature over 100.4, or you feel cold/feverish and have chills, thoughts of harming yourself or your baby or anyone around you, pain or burning sensation, redness, warmth, or swelling in one or both of your legs, breasts that are painful, swollen, hot, tight, itchy, or have sore spots with redness or red streaks, and you may have flu-like symptoms, sharp pains in your abdomen, breast, or chest, trouble breathing, dizziness, or faintness, crying spells or mood swings that feel out of control. You might have these for the first couple days after discharge, but they should go away in about a week. Unable to empty your bladder or urination is painful, difficult, or too frequent. This can be indicative of a UTI, and difficulty having a bowel movement. And then a hotline to report domestic violence or abuse. You can call 1-800-96-ABUSE, and I can write that number for you once we finish this teaching. So some important safety teaching about the baby. Sleeping. Place your infant on her back to sleep. Use sleep clothing such as one-piece sleeper instead of a blanket. Do not let anyone smoke around your infant. Use a firm mattress and a safety-approved crib covered by a fitted sheet. Car seats and other sitting devices are not recommended for routine sleep. Do not use pillows, blankets, or pillow-like bumpers in your infant's sleep area. Wedges and positioners should not be used. Keep soft objects, stuffed toys, and loose bedding out of your infant's sleep area. The baby should sleep in the same room as the parents, but not in the same bed. I know you're breastfeeding, so it's super important not to sleep with your baby right next to you, as this puts them at risk for suffocation in the middle of the night when you fall asleep after feeding and things like that. Avoid covering the infant's head or overheating when putting them to sleep. A bulb syringe. Keep the bulb syringe near the infant at all times to clear the infant's throat or nose if necessary. Clean the bulb syringe well with soapy water after each use and allow to air dry. Hand washing. Wash hands prior to handling the neonate, feeding, after changing diapers, dressing, anything like that. Car seat wise, all infants are required by law to be in a car seat while the car is in motion. Children should be placed in a child safety seat according to state laws. The use of outdoor announcements is not recommended to announce the birth of your sweet baby girl because they call attention to the presence of a new infant in the home, which can pose a safety risk for your whole family. Question any unfamiliar person visiting your home or inquiring about your baby after discharge, stranger danger. Do not use home monitors or commercial devices marketed to reduce the risk of SIDS, which is sudden infant death syndrome. Behavior-wise, crying, it's a normal response for your infant to cry. The most likely causes for crying are hunger, need for a diaper change, or needing to burp. You should burp your baby after each feeding. Calming techniques include feeding your infant, changing their diaper, gently rubbing the back or tummy, walking with your infant, rocking your infant, skin-to-skin contact, or giving your baby a pacifier. It is never okay to shake your infant. Please don't shake your infant. If you get frustrated or angry, put your infant in a safe place, take a break, and call a friend or your husband. Sleeping patterns. Infants require a lot of sleep. You should be waking your baby at least every 3 to 4 hours for feeding, or 2 to 3, whatever you guys have on routine with her for breastfeeding. You should place your baby on his or her tummy each day for supervised tummy time. This will strengthen her neck and abdomen. Breastfeeding wise, your infant should breastfeed about 8 to 10 times a day per her cues. It's different for every baby. Positioning, be sure to hold your infant close to you while feeding, just like you are now. Your infant needs to be cuddled, and skin-to-skin time is recommended. After feeding, hold your infant upright over your shoulder while gently patting and rubbing his back to burp. A few newborn characteristics which are normal for all babies. She might get a newborn rash. It is very normal for your baby to develop a rash on her skin. It appears with small red circular areas with a white dot in the middle. This does not require treatment and will generally resolve within the first week of life. Avoid lotions, powders, and perfume soaps. She may get some milia, which are pearly white bumps, usually on the face, especially the nose. They will disappear within the first week or 7 to 10 days of life. Nothing to be too worried about. Jaundice is a common occurrence in newborns. Your infant may appear to have a yellow coloring to her skin. It will start in the face and progress down to the toes. If your infant appears more yellow in the next 24 hours, you need to call your primary healthcare provider immediately or your pediatrician. And then a couple things about infant care. Giving your baby a bath. Your infant will need to be sponge bathed until the umbilical cord falls off. Using a soft washcloth and plain water, gently wash your infant's face. Not cold water, but lukewarm water to where they'd be comfortable. Bathe your infant from head to toe, saving the diaper area for last. Mild infant type soap may be used on your infant's body. And then cord care. Until the umbilical cord falls off, we need to keep it clean and dry. Cleanse with warm water and soap when soiled. Inspect the cord and surrounding skin with diaper changes and notify the pediatrician if discharge or discoloration is noted. The umbilical cord will generally fall off within the first 2 weeks of life. Regarding wet and dirty diapers, 1 to 2 wet diapers are normal for the first day or 2 of life. Day 3 and 4 should have 3 fecal and wet diapers. Then you should expect to have about 6 to 8 wet diapers of pale urine every day. Over the next few days, your infant's bowel movements will begin to change from a yellow, greenish to a mustard yellow and will soften in consistency. Your infant should have at least 1 bowel movement every 24 hours. You may want to keep a record of your infant's wet and dirty diapers to monitor adequate elimination and hydration. I see your baby is a girl, so I will go over a couple quick tips about her genitalia. Always wipe baby from front to back when cleaning a diaper. Be sure to cleanse all creases and folds to prevent diaper rash. Pat, dry, and diaper. It is normal for baby girls to have a white or pinkish discharge. The secretions are normal and will gradually disappear. We're almost finished up. Dressing wise, dress your infant as you would dress yourself. Avoid overdressing her. Too much clothing and too many blankets may cause your baby to become overheated. And then vaccine wise, infants should receive all recommended vaccinations. You can speak with your pediatrician if you have any questions or concerns about the vaccines themselves. And babies typically get their first hepatitis B vaccine within their first 7 days of life. She can have it now in the hospital or once you guys see your pediatrician for the first time this week. Do you have any questions or concerns about your discharge teaching?
How do we know if she's getting enough milk while I'm breastfeeding her?
That's a great question. Typically, if your baby's getting enough milk while breastfeeding, they will have a wet diaper at least 10 times within a 24-hour period. And if she has less than 10 diapers, then you know she might not be getting enough milk during each feeding.
Okay.
All right, thank you so much.